Assalamu alaikum wa rahmatullah. Good evening, everyone. Hope you're doing well. Yes, I am Ahmed Hani Mubarak, the Academic Director of the Tababa Medics. On behalf of all Tababa members, I would love to welcome you all to our online course today, the Communication Skills Mastery. Learn how to learn the language of talk. Let me introduce to you Professor Imad Hassan, a consultant internist at the National Guard Hospital, Riyadh. He's a graduate of University of Khartoum, where he got his MBBS from. He got his MD from University of London, Clinical Immunology, and he is a fellowship of the Royal College of Physicians, Ireland, and a fellowship of the American College of Physicians, and a member of the Academy of Medical Educators, UK. The floor is all yours. Professor Imad.
مشكور دكتور هاني. السلام عليكم ورحمة الله. Welcome to this talk, which I promise will be very interesting and educational. I'm sure you will gain a lot of useful tips on communicating with your patients. I welcome you to this fourth meeting, actually, in the last 4 Saturdays. I had a talk on career management or career planning, and then a talk on the medical expert, or mastering the medical expert role, then mastering the professional role, and this talk is about mastering the communicator role. As I mentioned, I promise you it will be an entertaining and useful talk. You will hear new stuff. Actually, it's not in textbooks, it's still in medical journals. It hasn't reached the medical textbooks yet, right? So I welcome you all, and I'll start my presentation. My presentation actually has 3 parts. I'll have at least 3 short videos, all less than 5 minutes. I'll share with you, and I'm sure you'll find them amusing and entertaining, right? So I'll start sharing my screen and my first presentation. Right, I hope you can see my presentation there.
Yes, it's clear.
Okay, right, okay, Bismillah ar-Rahman ar-Rahim. Right, I'll be talking about mastering the communicator role, and communication is considered the top competency. Of all the competencies that healthcare workers are supposed to master, this is considered, communication is considered a top competency, right? My talk actually will have 3 components, and will focus on, on the audience acquiring 3 things. Why do we need to be experts in communication? People have to be able to list what patients love or hate about the doctors as a guide to what they should or should not do. And I'll finish with a new term, actually, it's called the language of talk. And this is the right words that we should use in patient-doctor communication, right? I'll start by this small quiz. It says, most clinicians believe that their patients are happy with them, particularly in the domain of communication. And this is the first question. Most clinicians believe that their patients are happy with them, particularly in the domain of communication. The second question is, most patients find their clinicians bad communicators. That's to say, if asked, most patients express dissatisfaction with their clinician's communication skills. And the third quiz actually is, communication skills are intuitive. Intuitive means they are, you're born with, and do not need formal training, right? So the 3 answers, right, if you actually look at the answers for these 3, right, as a matter of fact, most clinicians do believe that they are good communicators. 75% said so in one study. But actually, when the patients were asked, the majority thought that these clinicians were bad communicators, right? So it just tells how discrepant is the, what clinicians perceive and what actually patients perceive about communication. Clinicians tend to believe that they are good communicators, but as a matter of fact, patients most of the time don't feel so. And that's the importance of this talk today. It just tells what you should do or not do to become a good communicator and to be much loved by your patient. And then they said, very intriguing finding is that communication skills are not intuitive. And you're not born with good communication skills. You have to learn them, right? As a matter of fact, communication skills are actually acquired skills rather than born with skills, right? Now, the evidence is clear. That evidence suggests that physicians often remain emotionally distant, technical in approach, organ or tissue focused, and technology oriented, okay? If they are working with an electronic medical record, the patient is there and they are actually, talking, talking to the computer rather than to the patient, okay? And medicine moved from a healing profession to a business. Clinicians tend to look at patients as actually business or customers rather than human beings, okay? The objectives obviously are, for the next few slides, is actually how to engage your patients, right? I'll start by a simple definition for communication. Now, communication is the process of transferring signals or messages between a sender and a receiver through various methods, whether these are written, words, nonverbal, or spoken words, right? Written words, nonverbal cues, or spoken words. It is also a mechanism we use to establish and modify relationships. So yes, we communicate to transfer information, but we also develop or modify our relationships through these communications, right? Now, it is well known that communication is not only important in your work environment, but even in your career. People who are successful in their career are actually good communicators. In healthcare, we need communication to diagnose and treat disease, to establish and maintain a therapeutic relationship, and to offer information and educate. And these are the three major aspects, right? And in a healthcare setting, you'll find the patient in the middle, right? And so many healthcare providers around the patient, all in communication between each other and between them and the patient. Now, it's important to recognize that there are many types of communication, right? There are at least 10. There is patient and family-centered communication, history and physical, therapeutic communication, handover, consultation, motivational communication, breaking bad news, disclosure of error, dealing with angry patients or relatives, end-of-life communication, and written communication like follow-up notes, consultation, letters, discharge summary or medical report, death report, and so forth. So there are many actually modes of communication or types of communication. Now, the talk today is primarily about the phase 2, the patient and therapeutic communication issues, right? Obviously, others also need education on them, but maybe we will talk about them in a separate session, right? When you ask people actually, what's the importance of communication, right? Many people actually don't recognize that communication has a negative impact on so many elements of quality in healthcare. As a matter of fact, communication negatively impacts the errors in diagnosis and drug errors, right? If you don't find, for example, somebody is allergic to a medicine, you will actually, because of some poor communication, you might actually end up prescribing a wrong drug. And its importance in treatment compliance is known that if patients are well educated on their treatment through good communication, their compliance is better, right? It's important for patient satisfaction. Poor communication has been associated with increased healthcare expenditure, even bed availability. Poor communication has been shown to increase bed occupancy. People stay longer in the hospital just because of poor communication, either between staff themselves or between staff and patients. Readmission rates are increased if there is poor communication, because if Patients are not well educated. They go home, they take the drug in the wrong way, they are readmitted. Obviously, all of the above have impact on medical litigation. So people are being, taken to court because of poor communication. And this is obviously associated also with staff burnout and staff self-harm and even staff suicide because of poor communication and litigation issues. Right. So you can see that the importance of communication and its negative impact on so many issues in quality of healthcare and in actually staff themselves. So this is actually how important is, communication. Now, obviously, quality runs in parallel with communication. High communication quality, higher quality of communication, higher quality of care, and even better patient and doctor safety. As a matter of fact, communication is considered an important tool for improving safety, right? Not only for patients, but even for doctors, right? So competency in communication drives quality, and quality drives the care outcomes, okay? And this is just a caricature to see that, a patient who's just fallen at the side of a surgical table, you see, and that is why we lift on 3. So he didn't wait until he said the 3. So the patient actually went up, landed on the floor. Okay. Now, patients often don't understand and cannot recall the treatment plan. As a matter of fact, patients have to be told 3 times any bit of information for them to remember, right? And so in communication, you really have to actually say the thing 3 times before a patient will recall it after being seen in a clinic, for example, right? And don't forget that when patients are anxious or afraid, they need more pain medication and take longer to recover. You see, just relieving their anxiety reduces their need for pain relief. Just relieving their anxiety by good communication, right? Patients are more likely to follow a treatment plan if they were involved in creating it. And this is a fact which is, well known, right? They take part that's what's about patient-centeredness, patients taking part in decision-making. And patients who don't feel cared for are less likely to talk about the symptoms and more likely to complain. As a matter of fact, patients who actually feel that the doctor is a good communicator, is a good listener, they will not speak and explain or let the doctor know about all their concerns, right? Now, it's important to recognize that communication lapses are a common cause of patient harm. And as a matter of fact, this is a very serious graph which looked at sentinel events. Sentinel events means events that really led to harm or death, right? And you can see that communication as a root cause was actually the commonest reason. You see, so you should never underestimate the power of communication in actually, improving the quality of care and reducing litigation and so forth. Okay. So it is very clear that communication has an impact on patient outcome, right? And this has been actually shown. For example, they looked at blood pressure control and they looked at the communication style between patients and doctors, and patients who had a better communication style had better blood pressure control. Patients who had a better communication style are having better mental health scores. So communication is a tool that you can never underestimate its power. Okay, you just have to work on that. Okay, work on improving communication. And then another domain which people maybe don't pay much attention to is that communication is important also for improving our interpersonal relationships at work, intra-professional relationships at work, right? As a matter of fact, one of the major issues which are faced, for example, in healthcare is that this breakdown in communication between different levels of staff, and this what creates something called silos of care, islands of care, so that people actually don't communicate and don't benefit from each other. And obviously the patient does benefit as well from that. Now there are the common types of communication are only 3. These are the written, verbal, and the non-verbal. Now, the written, the verbal obviously are the spoken words. Okay, this is the way when we speak, right? And the written are what we write, actually, what we write in when we see a patient, the history and physical, for example. But the non-verbal, there are quite a few. There is haptic communication, which is the touch. You know, this is considered a major communication skill. You know, touch, the power of touch, haptic communication. And then there is chronemic communication of time perceptions, right? You know, for seeing patients at the you know, not keeping patients waiting, for example. Right? Another important chronemic communication is what has been recognized, that if you know, patients perceive time as an important element of communication. If you do the ward round and you go in and you're standing in the ward round, and if you go in and you sit in the ward, you sit, and when you see a patient, now people actually would feel that when you sat, you have actually spent more time with them, despite the fact that you might have spent much less time, right? So this is chronomic communication, you know, communication of time. Now, gestures, you know, body language, facial expression, eye contact, you know, the way you dress is actually a component of how you communicate with people, right? If you are well dressed, actually, you give them that reassurance that you are actually a highly professional individual. An important element of communication is something called the paralanguage or the paraverbal. And these is all about the voice rhythm, you know, the intonation. You increase your voice, you reduce your voice, right? You go fast, you go slow. These all have an impact on what patients perceive, right? So the nonverbal communication, the nonverbal elements of communication are actually very important. As a matter of fact, some people believe, or studies have shown, that actually most of our communication, what we perceive, are actually by the nonverbal element. So up to 55%. So, and even a further 38% through paralanguage. So actually, as a matter of fact, if you look at the communication equation, right, it seems that when we use words, we are actually using only 10% of our communication routes. So you really have to make sure that this 90%, you are a master of that. You know, the way, the tone of voice, are you talking clearly? Are you talking fast? Are you talking slowly? The way the facial expression, your dress and grooming, posture, eye contact, touch, and so forth. These are important elements, right? You have to make sure that your nonverbal communications are as great, okay? Now, eye contact, visible mouth, body language, silence, checking for smiling face, these are summarizing, these are important skills for having effective communication, right? Now, there are things which really make our communication horrible. And this is actually one of the major things which doctors actually, you know, suffer from, is actually the use of medical jargon. Okay, you are not supposed to use medical jargon when you are communicating with the patients, as most of patients won't actually understand of this. And obviously, you have to have a quiet place without distractions. Your phone should be, you know, muted if you are having, for example, breaking bad news or so forth, right? Now, and there are so many things, you know, distance, for example. When you communicate, you really have to sit facing the patient. The patient should not be sat across a table. Now, a patient sitting across a table means that there is a distance between you. So you should really be sitting facing a patient without anything in the middle, right? Now, I'll just mention a few things about history taking, because these are important things, right? This is very important. Now many people think that history is actually just for diagnosing the disease, for example. Now, it is true that history is for diagnosing the disease, or this is called the biological pathology, right? But history is also about something else, which is called the psychosocial pathology, or the illness. So we take history to know the disease, but we also have to find what's the illness. The illness is the impact of the disease on the patient. So when we take history, we need to know two things: the disease and the illness. These are two separate things, right? You know that you have mastered these two components when your patients tell you that just speaking to you make us feel better. And this is actually, you know, once a doctor reaches that stage and the patients come and tell him just speaking to you make us feel better, they know that I've mastered the art of history and history taking, right? The art of history taking is about both the disease and the illness. The patient, when they see that you are good in dealing with both the disease and the illness, right, and using the right language of talk, then you have reached that stage of when patients tell you that just speaking to you make us feel better. And actually, once you've reached that, be reassured that you have mastered the art of communication, of medical communication. Right. So it's important that you have plenty of time when you are actually taking the history. You just make sure that you're not rushed. You see, just make sure that you're not rushed. Now we take the history for 8 reasons. And again, when I ask my trainees, why do you take history? Right. Most of them actually fail to articulate all the 8. Right. Yes, it builds rapport, or what we call an jam, and often the basis of the differential diagnosis and the diagnosis. As a matter of fact, the majority of medical cases, 80% are diagnosed from the history alone, right? It just tells us, while I'm taking the history, for example, if I feel the patient has heart failure, I'll be looking for the signs of heart failure, like a raised JVP or a Gallop rhythm or lower lymphedema, because of shortness of breath, causing shortness of breath. This is called hypothesis-driven physical exam. As a matter of fact, while you're taking the history, you should be able to decide what are the signs you're looking for, rather than doing like an undergraduate, an undergraduate student, a medical student, who actually just do a full examination, not knowing what to look for. But as an expert clinician, the history directs you to what to look for in the physical exam. It tells you, obviously, when you've made a diagnosis, the differential diagnosis, tells you what tests you need to do. It tells you what immediate interventions. You took the history, right? And in the history, the patient says that they have pain. Okay, you have decided on one treatment, which is pain relief or analgesics, even before making a diagnosis. And as even supporting care. For example, a patient who tells you that he is breathless, and then you know that he probably needs some oxygen even before actually finishing making the diagnosis. It tells you whom to refer to, because as you're taking the history, you find some comorbidities which need other specialties, and it also helps you as it assists you in selecting the most patient-centered and safer specific therapy. I mentioned the issue about the penicillin allergy, drug allergy, so that it's safer. You need to be safe, right? Now, coming back to the distinction between the biological, the disease, and the illness. The illness is the person's unique experience of whatever disease he or she has and the behavior resulting from it. This is what is called what matters to the patient. So you need to know what is the matter with the patient, but also what matters to the patient. What matters to the patient is the illness, the impact of the illness on the patient. Okay, so you really need to make sure that you know these too. Okay. When you want to engage a patient and you want to establish a relationship, by all means, you have to have a quiet and private location. Make sure that the patient can be made more comfortable. As a matter of fact, not many doctors pay attention, or ask the patient, "Are you comfortable there?" Right? You want me to make you more comfortable. Make sure there is eye contact, appropriate distance and position. Obviously, there are social issues there. People might need, for example, need to keep a distance, a safe distance, which is culturally appropriate, right? And obviously, make sure that they are in a safe place and show respect and this personal zone, right? Make sure you use open-ended and close-ended. Open-ended questions mean that you just ask, "Tell me about something." Now, close-ended means the answer is only yes or no. Close-ended, okay, do you have headache? Yes or no. Do you have abdominal pain? Do you have tummy pain? Yes or no. Do you have diarrhea? Yes or no. But open-ended question, "Tell me about your diarrhea. Tell me about your tummy pain." Okay. And some people, when use multiple choice questions, they're not sure, So you tell them, "Okay, your pain, is it dull? Is it sharp? Is it like this?" So you give them like a multiple choice question. Okay. One important issue in communication is actually, being prepared for seeing the patient, right? You're not allowed to come in and see a patient without actually looking at the old notes or labs or imaging, right? Or not knowing the patient name and asking, "What's your name?" Okay, that's not the proper thing. You have to find, you from the beginning be prepared to know the patient's name, okay, and look at the old notes, okay. And obviously, this is an important thing. Wash your hands. This is advocating for patient safety, right? You don't want to be, you don't want to be passing an infection from one patient to the other. Introducing yourself, this is an important thing. And, many people, for example, doctors come into the ward round, that they don't inform the patient that we are the consultant, or I am the registrar, and the patient is left wondering. As a matter of fact, they had a study in our hospital here, and they found almost 30% of patients did not know the name of their consultant, which was really sad, right? They are under a consultant and they didn't know the names of the consultant. Explain your role, acknowledge and greet others. And this is another thing, right? You come into the room and there are also relatives. By all means, say hello to the patient and also say hello to the others, right? Some patients have their nickname and they like to be called by this. By all means, make sure that you know the nickname, okay? Show empathy and care, for example, ma'jurin inshallah wa ajra inshallah. These actually help people, get, feel more comfortable, okay? And obviously listening. Now this listening thing, now I'll come to it again in the next presentation, but Mark Twain said, if we were supposed to talk more than listen, we would have been given 2 mouths and 1 ear. As a matter of fact, for us, we listen a lot more than we talk when we see our patients. This is actually a golden advice. Okay, right? And actually, this is a doctor. Actually, as a matter of fact, he's not a good doctor, but this colleague is intrigued and asked him, "But you get along with everyone. What's your secret?" And he says, "Nobody hates a listener." As a matter of fact, one of the reasons why many patients like doctors, even when they are not really great in their profession, in their clinical profession, right, is just because they are good listeners and the patients find them very approachable, right? So this is just an introduction about the issue of communication in healthcare and its impact on the quality of service, on the outcome of healthcare, okay? And why we really need to be good communicators, and the basic tips on communication, and the reason to be actually to listen a lot more than we talk. As a matter of fact, doctors most of the time, interrupt their patients in less than 20 seconds, and this is what the literature has shown. So we really have to be excellent listeners and give our patients an excellent profession, an excellent communication style, right? So if we stop here, please, and we'll